Hello and welcome. Thank you for joining us today for the launch of Season 2 of The Pitch, the competition that finds and funds knowledge champions for family planning and reproductive health. My name is Grace Gayoso. I'm the one leading the partnership work in the Asia Pacific region for the Knowledge Success Project, and I'm your moderator for today. We'll be starting in a few minutes, but while we wait for the others, please do introduce yourself in the chat box and please do share with us what you're most excited about for season 2 of this competition. All right, so hello once again. Can we open the first slide for today's event? Hello again, and for those who are just joining right now, my name is Grace Gayoso, and I'm the one doing the work for Asia Pacific region in the Knowledge Success Project, and I'm your moderator for today. Thank you once again for joining us today for the launch of season 2 of The Pitch. The Pitch is a competition led by the Knowledge Success Project that finds and funds who are knowledge champions in family planning and reproductive health programs. Knowledge Success is funded by the USAID's Office of Population and Reproductive Health. We are the only global project in the family planning and reproductive health that has laser focus on knowledge management. Our work helps family planning and reproductive health programs share more, learn more, and do more. We are excited to share with you today some important details about the competition and answer questions that you might have. This webinar will last for approximately 1 hour and 15 minutes, and throughout this webinar, please type in your questions and your comments in the chat box. We have time allotted for you for Q&A to make sure that we will be able to answer your questions. And finally, we are recording this webinar and we will be emailing the recording out by tomorrow. Next slide, please. So we are also providing live French interpretation during this webinar. If you would like to listen in French, please click on the interpretation icon at the bottom of your Zoom screen and then click on French. You'll then have the option to mute the original audio in English if you do not want to hear that in the background. Next slide, please. You may also select whether or not you would like to read the captions on the screen or during the session. You should be seeing this automatically right now in your screen, but if you don't, you just need to click on that icon that you can see with two C's and then just click on that. And if you wish to hide the captions later, just click on the same icon and click hide subtitle from the menu that appears. These captions are generated through an automatic feature in the Zoom platform. So it means it may not be 100% accurate. So for the Zoom, on the Zoom platform, captions are only available in English as of the moment, unfortunately. Next slide. So once again, my name is Grace Gayoso. I'm the one working for the partnership in the Asia Pacific region for the Knowledge Success Project, and I'll be your host for today. Next slide, please. So here's the plan for our session for today. So today we're going to hear an overview of how the pitch came about. We'll be listening to some insight from a season 2 judge, engage in a roundtable discussion with a season 1 KM champions, and go over the season 2 competition guidelines and questions. Next slide, please. So during this session of the pitch, season of the pitch, up to 5 organizations based in Sub-Saharan Africa and Asia will each be awarded up to 50,000 US dollars via a sub-award process to be able to implement their knowledge management innovation. Next slide, please. So as a project, Knowledge Success seeks to support a network of knowledgement champions and innovators in Sub-Saharan Africa and Asia who can strengthen knowledge exchange and collaboration and also enhance meaningful learning to improve family planning and reproductive health programs. So the pitch supports these goals in 3 ways. First is by providing seed funding to KM champions working in family planning and reproductive health at the national and regional level. Second, by breaking down barriers impacting widespread implementation of knowledge management, like the assumption that KM is difficult to implement. So how do we do it? By showcasing creative and practical ideas. Third, by financially supporting the development of innovative KM solutions by the organizations who know best the need of their regions and who are best positioned to lead these solutions long term. So in season 1, we were able to make these big steps towards reaching this achievement. Next slide, please. So now we are going to have a recap of what happened in season 1 of the pitch. So season 1 of the pitch premiered in June of this year, and our first season drew more than 80 submissions from organizations in Africa and Asia and 3,283 visitors to the landing page. And the final watch parties had more than 1,000 views. Well, not bad, right? So 4 KM champion innovators, 2 based in Sub-Saharan Africa and 2 from Asia, were selected to be awarded up to 50,000 US dollars each to implement their ideas. Next slide, please. So the 4 season 1 KM innovations included the White Ribbon Alliance for Safe Motherhood Malawi. They created a family planning dashboard on DHIS2 that links to the Malawi's Ministry of Health website, strengthening data for decision making. The second one is Stand with the Girl initiative in Nigeria, who implemented the Data Made Simple project that strengthened the capacity of youth data advocates to interpret HMIS data on adolescent use of contraception by creating storybooks, infographics, and illustration depicting district level data. The third, KM innovation during season one, Safe Delivery, Safe Mother in Pakistan. They conducted data analysis training with the governments and postpartum family planning training with skilled birth attendants. And the last one, Jipaigo India created FP Connect, a centralized knowledge management system to collect, organize, and house family planning and reproductive health resources. So later in the program, we will be hearing directly from our 4KM champion innovators. So they'll be sharing a bit about their innovation, and they will also be giving advice to those who are planning to submit their idea or application for season 2. So make sure to stay tuned for that one. Next slide, please. So before we introduce the details of the competition, I am going to hand it over now to Tara Sullivan, the project director for Knowledge Success. So Tara served as the judge for season 1 of the pitch and will also serve as the judge for season 2 of the pitch. So that's why we asked her to tell a bit more about knowledge success, knowledge management, and what she will be looking for during the submission process. So Tara?
Wonderful. Thank you so much, Kayo, and good morning, good afternoon, and good evening, everyone. I'm delighted to have you join us today. Next slide, please. At Knowledge Success, our objective is to ensure that family planning professionals can find, share, and use the knowledge they need. Our work focuses on knowledge management for family planning professionals. That's you. So what does knowledge management really mean? We define knowledge management as a systematic process of both collecting knowledge and connecting people to it so they can act efficiently and effectively in their work. Knowledge is our most valuable asset to address global health challenges. What we know impacts how we take action, and how we manage knowledge can affect individuals, programs, and ultimately health systems. Many of us practice knowledge management every day without realizing it. For example, when a healthcare provider refers to the latest guidelines on how to treat a disease, they are using knowledge management. When a program manager reviews family planning data in order to inform their programs, or when a technical advisor joins a working group to share implementation details with external colleagues, they are all using knowledge management. In each of these examples, health professionals are collecting knowledge and connecting people to it so they can do their jobs more effectively. Next slide, please. Although we recognize knowledge management as essential for our work in family planning and reproductive health, there are several challenges that prevent us from accessing, sharing, and using knowledge to its full potential. Some challenges include just simply too many options and too much information. Sometimes information is presented in a way that makes it really just not that easy to understand. We also have a lack of access to information, and sometimes that can be due to paywalls or language barriers or other reasons. Information is not always contextualized, and data may be absent or be of poor quality or outdated. Limited information on what does work and does not work in family planning, including a lack of practical actionable information on lessons from other projects, can also be lacking. And then finally, there may be a lack of coordination and systematic sharing. Next slide, please. With these barriers in mind, what kinds of knowledge management solutions can we envision for season 2 of the pitch? The ultimate goal of knowledge management is to bridge that knowledge to action gap. by strengthening the use of data, information, and knowledge to inform our family planning and reproductive health programs. With that, we expect that the KM innovations awarded under the pitch will likely fit into one of these three categories. A first bucket is knowledge management solutions that collect and organize family planning and reproductive health knowledge so that it's easier to find, share, and use. A next bucket are those solutions that connect people to the knowledge they need and also to each other so that they can share and exchange information, ask questions, and enhance collaborations among professionals and organizations. And finally, knowledge management solutions that focus on knowledge management capacity strengthening or mentorship opportunities so that family planning and reproductive health professionals can learn and grow their skills. This season of the pitch, I am particularly excited to see KM innovations that will help family planning and reproductive health professionals adapt and respond to COVID-19 in their programs, and KM innovations that are spearheaded by youth or that support family planning and reproductive health professionals to meaningfully engage youth in knowledge management. These are two new themes for this year that you'll hear about from Ann Ballard-Sarah later in the webinar. I'm also interested to see innovations for interactive knowledge management techniques that connect family planning and reproductive health professionals to one another and that make sharing our implementation experiences easy and routine in an effort to strengthen our programs. The practical knowledge gained from our experiences is equally important to the data, so I'd like to see innovations that spark discussions around what works and what doesn't work to inform our family planning and reproductive health programs. During the scoring process, I'll be looking specifically for innovations with a strong sustainability plan to ensure that the innovation can continue past the implementation period. And I'll be looking for submissions that clearly outline how the success of the innovation will be measured. So I encourage you to think through how your KM innovation will be integrated into existing systems, policies, and practice, and how you'll measure success. Finally, I'll be looking for submissions that support the appropriate audience for our knowledge management innovations, which are program managers, technical advisors, and decision makers, but not our family planning clients themselves. Next slide, please. So with that, I am pleased to announce that the Bill and Melinda Gates Foundation will not only be back as a judge for season 2, but has also joined USAID as a co-sponsor for season 2 of the pitch. Next slide, please. And so I'm really pleased to invite Emily Mangoni, a program officer with the Bill and Melinda Gates Foundation, to provide a few remarks. Emily, can you tell us a bit about what excites you for the pitch, why the foundation chose to co-sponsor the pitch, and what you'll be looking for in submissions? Over to you, Emily.
Thank you, Tara. The Bill and Melinda Gates Foundation is proud to be a co-sponsor of this event alongside USAID, and we are looking forward to seeing what innovations might emerge. Working with people and organizations who are thinking creatively about how to solve challenging problems is very energizing and expands our own horizons. So I'm excited to geek out over knowledge managed innovation with this year's innovators. For those who submit ideas, I hope you will be ambitious in your innovation, thinking towards global outcomes, even while focusing on challenges that are unique to your own community, country, or region. I hope you will think outside the box on technologies and partnerships, including potentially those with the private sector. This competition could be the first step towards real progress on data-driven decision-making. I mentioned data because at the Bill and Melinda Gates Foundation, data drives every decision that we make so that we can make the biggest impact possible. We invest in family planning initiatives because the data tells us that enabling women and girls to choose if they want children, when to have those children, and how many children improves their health, the health of their children and families, and their access to educational and economic opportunities. We know this thanks in part to effective knowledge management systems and efforts that have translated millions of data points into a clear and coherent message to act. My advice for this season's contestants is to plug into existing systems, One of the major challenges to knowledge exchange in family planning and reproductive health is when people and platforms don't talk to each other. This leads to duplication and fragmentation of information. Understanding the ecosystem of knowledge management platforms and networks that already exist and the key stakeholders involved will not only help you understand how your innovation fits into the bigger picture, it will also help you think proactively about the sustainability of your innovation, which, as you heard from Tara, that's a big part of what she's looking for in her judging. It's vitally important that your innovation harmonize with what already exists in your country or context. The family planning dashboard created by Season 1 winner White Ribbon Alliance Malawi, which was added into the DHIS2, an existing platform managed by Malawi's Ministry of Health, is a great example of a knowledge management innovation that integrates seamlessly with current platforms already in use. The COVID-19 pandemic has tested the resilience of our health systems and has highlighted the critical need for innovation in how we collect and use data to respond to health crises and ensure that women and girls maintain access to essential products and services, including contraception. Now, more than ever, we need to think about the disintermediation and democratization of the access and use of knowledge and data. Again, we are so pleased to join USAID and Knowledge Success as a co-sponsor for Season 2 of this promising and innovative competition. I wish everyone the best of luck, and I'm so excited to see your submissions. Thank you.
Thank you very much, Emily, for that wonderful and insightful remarks on what to expect for Season 2 of the pitch. So now I would just like to shift gears and welcome our Season 1 KM champion innovators for a roundtable discussion. So this is exciting. They'll be sharing a little bit more about their KM innovations and also providing advice for the Season 2 applicants. So make sure to listen to them. So today we'll be hearing from Hester Nyasulu, the Executive Director of White Ribbon Alliance Malawi, Margaret Bolaji, Founder and Executive Director of Stand with a Girl Initiative and the Data Made Simple Project in Nigeria. We also have with us Marine Shahid, founder and chairperson of Safe Delivery, Safe Mother in Pakistan, and Priti Chaudhry, National Program Officer of Jipaigo, India. All right, so next slide, please. So first, we'll start with the White Ribbon Alliance. So I would just like to remind our speakers for today to keep the answers sweet, short and sweet, so that we'll have more time for our question and answer with our audience. All right, so Hester, White Ribbon Alliance for Safe Motherhood Malawi created this family planning dashboard on DHIS2 that links to the Malawi Ministry of Health website, strengthening data for decision making. So the question is, why is it important that family planning and reproductive health professionals have access to quality and up-to-date data? So how did the family planning dashboard created by the White Ribbon Alliance Malawi address this issue?
Thank you so much, and greetings from White Ribbon Alliance Malawi. Data is very important for decision-making, program design, and advocacy. Now, without quality data, FPRH professionals will be making wrong decisions, implement programs or interventions that are not responsive to the needs of their target population, especially women and girls, and they'll be providing wrong information during their advocacy initiatives. Now, in our case, the dashboard that we've managed to develop has enabled the FPRH professionals to have quality data in real time and in a more comprehensive way. The dashboard has almost all the information that you need in family planning, including access to family planning methods by age, stockouts, type of methods being used, and all the information that you need in terms even on reporting and information for each and every health facility in Malawi. So apart from developing the dashboard on DHIS2, we also have a link that enables FPRH professionals to access data through their phones. And it's also available on the Ministry of Health website. No need for login credentials at this point. Now, we're already seeing FP professionals using the dashboard and engaging in their meetings using the data that is now made available. And we're excited that this innovation is already a change maker in Malawi in terms of data access. So that's what we're seeing improving, where in the discussions that our FP professionals are having, they're now using the data from the dashboard. Thank you.
All right, thank you, Hester. So it's good to know, that family planning and reproductive health professionals are now using this dashboard that your organization has made. So now, most of the audience would probably want to know this. What advice do you have for organizations who are planning to submit or pitch their ideas for season 2?
So the advice that I have is that they need to really understand the problem that is there, the gap, and come up with something very simple and more sustainable solution that can address the challenge. So to us, the dashboard was the answer, and it became the answer, and we are seeing the results now. Yeah.
Okay, thank you. Simple and sustainable. That's from Hester. So thank you very much, Hester. And now let's hear from Margaret from Stand With a Girl Initiative. So Stand With a Girl Initiative, Nigeria strengthened the capacity of youth data advocates to interpret HMIS data on adolescent use of contraception through storybooks, infographics, and art. And the ultimate goal of this innovation is to advocate for adolescent responsive family planning or reproductive health programs among policy makers at local and state levels. So my question for you, Margaret, is why do you think it's important from a KM perspective for young people to be involved in analyzing, interpreting, and presenting data related to adolescent and youth sexual and reproductive health? And also, how did the data made simple storybooks integrate youth and data for policymakers?
Can you hear me now?
Yes,
Okay.
Margaret, there you are.
Okay, so thank you so much for your question. It's been an interesting journey for Stand With a Girl initiative in Nigeria, and of course for every young person that we've been able to engage. So for us, one of the key objectives, which was actually the first, and it was deliberately the first, for Data Made Simple project, is promoting meaningful youth participation in data for decision making. So oftentimes, when we look at the whole spectrum of meaningful youth engagement, we know that it has to cut through the entire project cycle. So right from the design, the implementation, but not so much has been done with regards to data. And I know even speaking with my peers, people would say, oh, maybe data is for the older people in this field, and it's just a lot of numbers, we're not interested, and it just can be confusing. But for us, we were interested in seeing that throughout the life cycle of the project, particularly during the project design, we ensure that there was adequate representation and integration of young people's unique and innovative perspective. And we had to do this by selecting youth data advocates, and they played a very critical role in ensuring that the data presented told a compelling story about adolescent and youth sexual and reproductive health. So for the selection, we had criteria, and was basically looking at young people who were already involved at the state level, that's the subnational level, and they were also members of youth-led society, civil society organization, and they were interested in adolescent and youth data. They had knowledge and experience and even understanding of AYSRH issues, and they were very, as we all know, these characteristics with young people, they were very creative. They were willing to throw away the box and really think on how to interpret, analyze data in very simple, catchy, friendly manner that can be used for decision making. And even before just having them interpret this data, existing AYSRH data, the organization also ensured that we strengthen their capacity on data use for decision making, also knowledge management, understanding the importance of representing existing data into pictorial formats, graphics, infographics, and all of that. So these young people were not just selected, but they were also equipped with the right skill to be able to do the same. And you know, during one of such kind of training, one of the young persons said, learning how to translate data in a story form has really helped me to comprehend information about adolescent and youth sexual and reproductive health. So it was also a way to have young people sit with data that speaks to issue about them. So enough of being just emotional, while it's important to tell stories, we also need to be, the stories need to be data driven. So young people were excited to be part of it, to understand data and by themselves simplify this data into graphics, into something simple. And moving forward, we saw that it was the best thing that happened during the lifespan of the project because it provided the organization with rich content supported by data and paved way for us to also leverage on existing platform, remembering that this data made simple project, the storybooks that were developed were ultimately going to be used to engage decision makers. And apparently young people are working with those decision makers. They have different platforms and they're able to leverage on it to be able to disseminate this the storybook. So for us, it was win-win having to engage young people. It was fun. It was also a really great learning for us, bringing young people into the room to really talk about data, simplify it. And today we're glad that we have storybooks from all of the 5 states that we worked in. And the storybooks were also further translated into indigenous languages for community leaders, decision makers to understand and be able to make impact. And as I speak to you, young people are on the field engaging decision makers using this very simple and catchy storybooks. Thank you.
So thank you. Thank you very much, Margaret. This is very interesting, right? So building the capacity of youth on how to use data, but balance also of being creative on how to use data and then advocacy as well. So now the golden question, what would be your best advice for those who will be applying or pitching their ideas for season 2?
Great question. So again, just from the name, we're looking for innovators. So it's important to know that you want to talk about something new, but while looking at those very innovative ideas, I believe you can come up with amazing idea. I really look forward to hearing about the so many innovative ideas that we'll be submitting. Ensure to wear the cap of sustainability. That's very important. So for us, even despite that storybook, it was quite new and we were putting in, hello, can you hear me?
Yes, we can. I can.
Yes, so
yes.
we were putting in those new caps to ensure we're putting in new things, but we're also ensuring that we're integrating into existing structures. So these young people are from youth-led organization. They are from technical working groups. So in all that you try to do while you're putting up these beautiful and innovative ideas, ensure to wear the sustainability cap. Thank you.
Thank you, Margaret. So creative, innovative idea, but sustainable as well. Thank you, Margaret. So now we will have some questions for Marine of Safe Delivery, Safe Mother. So Marine, the Safe Delivery, Safe Mother in Pakistan, you have conducted participatory in-person training on postpartum family planning for skilled birth attendants, as well as data collection, analysis, and dissemination trainings with the health department. So the question is, what role does data collection and analysis play in regard to postpartum family planning uptake, and how did the Safe Delivery, Safe Mother data training help address this issue? Marine?
Thank you so much for the question. And when you talk about data collection and data analysis, I cannot stress enough how important that is, and not only in the context of postpartum family planning, but also broadly within the context of primary healthcare. So, when we started out with this innovation, and we thought, and I was thinking about what is the way that we need to move forward, there were 2 to 3 key elements that came in my mind. I thought, it's important to be sustainable. More importantly, it's also important to be scalable, which means we have to work with the public health system. So what we did essentially was that we are supporting we picked up the Punjab province, which is the most populous province of the country, which has over 65% of the population. Specifically, that's over 110 million, to just give you a size of the scale. So what we did is we're working with the maternal and child health department, where we have taught their staff, their data management staff, how to collect, analyze, and manage data. This is essentially very important because what happens is that they capture data from the field in the form of digital data as well as paper-based. So once that's collected, they're the ones who actually have the wealth of data of the entire province, which is around all maternal, reproductive, child health. So we moved actually well beyond postpartum family planning. What we've done is we've taken their real-time data, which comes on a monthly and weekly basis. We've broken that down for them, taught them how that actual analysis takes place, what are the insights you draw from it, what are the gaps and challenges. So that is directly then linked to policy formulation. And what they do with that data, this is the data that's then presented to the department, that goes on to other sectors. So first was looking at where can we have the most impact and how should we target that. So I think we nailed that very well with this innovation and the support that we got from Knowledge Success. That was one element of it. And the second most exciting element was we picked up a high priority district of one of the high priority districts of the Punjab province. Specifically, we went to Multan in South Punjab, and we basically taught all birth attendants of 24/7 primary healthcare facilities on family planning and postpartum family planning services. What that helped us to do is not only understand the challenges of the area, but most interestingly, we taught them on key elements of postpartum family planning, which they've never been taught, and they're not even practicing those. So seeing that uptake, actually I've been in the field this week, so actually been going around the district and seeing that uptake and seeing what they're actually practicing is what the most exciting part is, which again, just to give a bit of link, is they collect and report that data, which goes to the province, which then goes higher up. So this is what we've done in terms of our approach. It's been quite comprehensive. The outreach has been massive. We've strengthened the public health system, and we've been able to achieve that sustainability and scalability because they own the system, right? We haven't created any private or parallel caterer, and looked at both paper and digital reporting. So I think the way we've kind of implemented that, and especially in a short period of time, I think those are some of the elements to look at. In a short period of time, we've done massive amounts of work. We've trained over 200 birth attendants, and now looking at data at the headquarters in Lahore for the entire Punjab province is massive. As I've told you, the scale of the province that we have. So this is what we've done, which is why data is very important. And as is the case with a lot of the other fellow pairs here, there's a dearth of data. So we need to look at how we can strengthen it, improve it, disseminate it, and create a platform for it to be shared amongst other stakeholders. So that's just a concise, hopefully brief overview of what we've done so far. Thank you.
All right. So thank you, Marine. Comprehensive, massive area, targeted, and also integrated within the government system. So Marine, what is your best advice for those who will be applying for season 2 of the pitch?
So I think a couple of things are really important when you're looking at something like this, specifically if you look at postpartum family planning or even family planning broadly, which falls in the ambit of maternal and reproductive health. Look at where the key issues are. Pick up one of those key issues that are affecting your country. Look at what is the sustainability element, which in most cases is working with the public health system or collaborating with other stakeholders who have a seat at the table. So that's one end. Then look at how you can actually sort of bring it down to very simple terms which are executable down to a community level. That's where the data comes from. That's where the real execution happens. So looking at that is very important. And then most importantly, look at how you can share that data, how it's being disseminated. So for example, even the trainings that we've done in the field in Multan, we've developed very interesting infographics, easy to read, accessibility of uptake of knowledge, which we have basically been sharing with the government as well and other stakeholders. So look at these elements are very important. And I think what most important and exciting, and I rather challenge yourself to this, is if you can make it scalable, which we can. Our solution is actually something that will go to other provinces. We can share our solution with other countries facing similar issues, and we're able to replicate that. So I think look at that as well. Challenge yourself with the scalability and the replicability of your solution. Thank you.
Right. Thank you. Thank you, Marine. So simple, yet scalable and replicable. That's the advice of Marine. Thank you, Marine. And if you have some
Thank you.
questions, please do type them in the chat box. So we'll make sure to answer those questions in a while if you have for our speakers. Next is, now let's hear from Priti of Jipaigo, India. So Priti, Jipaigo, India created this FP Connect. So it's a centralized knowledge management system where family planning and reproductive health information from key organizations and projects in the country is collected, organized, and housed electronically. So to be able to share experiences and also coordinate activities and discuss important developments in the family planning and reproductive health sector. So, Priti, how does the FP Connect platform enable the family planning and reproductive health professionals connect with resources and one another? And why this type of knowledge exchange platform is important? Priti?
Thank you, Gayo, and hello, everyone. I think this is a challenge which many other countries might have also experienced. So what we observed in India is that we have lots of partners who are working together. We have the government stakeholders who are working, and they all are developing lots of resources on the FPRH. But when you try to find a resource from one source, it is very difficult. So the problem was that the FPRH information is available, but it's very scattered and unorganized. So we thought, why not bring all that information to a common platform? And that's how we came up with this idea of a knowledge management platform, FP Connect. And the main thing was that we wanted to connect all the professionals in the country together, because what happens sometimes is that one organization is implementing some innovative idea, but at the same time, some other organization is also replicating the same efforts. So if you see, that leads to a duplication of efforts. And we all know that the resources, whether it's monetary or HR, is limited in every country. So we felt that somewhere that wastage is occurring also. And our organization is implementing something, some other organization is implementing some other innovation or implementing some other efforts. So what happens is that we don't get to learn from each other, or we don't get to learn from each other challenges or the best practices. So this FP Connect platform was developed, and thanks to Pitch, we came up with that idea because somewhere that pushed us for developing a new innovation. And in this platform, if you may visit, so we have developed a digital platform, a website has been developed where all the resources from all the partners is available. And thankfully, this is for the first time that the various development partners in the country and the government has come together to a common platform. So it has been a big win for us, bringing them all together at the one platform where they all are sharing resources on a regular basis. And those resources are open and easily available to everyone in the country. Apart from that, on this platform, we have developed various discussion forums where users can connect with each other, raise queries, and talk to each other about their challenges, or they can even comment on other notes or the resources. This platform, along with the resources, is also giving the information about the various jobs and events which are taking place in the FPRH community. So if you are looking for a FPRH job or you want to seek a consultant, so that this platform acts as a one-stop solution for that. So and also apart from that, the users have the access to post the community, which we call the community post, where they can post about their thought process, their best practices from the field, their challenges from the field, or about any event. So this FP Connect platform has also achieved in bringing the voices from the field to everyone. And that's what we feel is our biggest achievement, that bringing the development partners and the government at the common platform, and also bringing the voices from the field. And as one of the FP advisor, the government FP advisor said that with FP Connect, we have gone corporate. So it's a first initiative where it's all the private sector organizations who are coming together for the first time. And that's what we feel, that it is connecting everyone together. Thank you.
All right. Thank you, Pretty. So many things. And many things, many information can be seen in FP Connect. So now the golden question again, Pretty. What will be your best advice for those who will be submitting their applications for season 2 of the pitch?
So my advice would be that go with the heart, because if is there an issue you feel from the heart that it needs a solution. So then you will be definitely able to come up with the best idea. And as Margaret said, please think about the sustainability, because the resources are limited. So come up with a solution where you already have an inbuilt sustainability plan. So that will take your solution forward, and it will also make it scalable, as Maureen said. Thank you.
All right. So thank you, Pretty, from the heart. And again, the issue of sustainability, always keep that in mind. So if you have some questions, please do type in the chat box, and our speakers will be answering your questions in the chat box. But don't you worry, this will be not the last time that you will be hearing from our innovators, because soon we will be promoting the innovations that they made and how they implemented it. So once again, thank you to our speakers, to our season 1, KM Champion Innovators, for such wonderful insights and also for your advice about your experiences during the season 1 of the pitch. So actually, your innovations are truly transforming on how we see or how we think about knowledge management in family planning and reproductive health. That's why we are so excited to see what is there, what to expect for season 2. And let's give our speakers a huge virtual round of applause there, or if you can have your reactions there. Okay, an applause for our speakers or KM Champion Innovators. So I'm going to turn it over now to my colleague, Anne Ballard Sarah, Senior Program Officer and Lead for the Pitch Season 2, to discuss the competition guidelines. So make sure that you listen. And
hello, Gaio. Good morning, good afternoon, and good evening, everyone. I'm very happy to be with you today. As Gaio mentioned, I'm Anne Ballard Sarah. I'm the Senior Program Officer with the Knowledge Success Project. And if we can move to the next slide, I'm happy to be talking with you today about the guidelines and the eligibility criteria for the Pitch Season 2. But first, I want to cover some details regarding why we hope you participate in the Pitch Season 2 and why we hope you submit your wonderful, innovative knowledge management ideas. So the Pitch is an opportunity and a platform to introduce your knowledge management innovation to a really broad audience. You know your context the best. You know what challenges family planning and reproductive health professionals encounter when trying to access knowledge, when trying to share knowledge, and when trying to use knowledge to inform their programs. And we want to hear your innovative solutions to those challenges. So we really encourage you to submit your ideas this season. Overall, 2 knowledge management champion innovators per region, so 4 finalists, will be awarded up to $50,000 each to implement their innovative idea. This season, we're also really excited to announce that we'll be providing a 5th award to an innovation of the judge's choice, and that award could be from Africa or from Asia. The final KM Champion Innovators will also receive tailored knowledge management training and support from the Knowledge Success team throughout the implementation period, and this support will be specifically tailored to the needs of the organization and the innovation that's selected. And finally, the KM Champion Innovators will have the opportunity to share your experiences and your innovation with the broader family planning and reproductive health community after the implementation period. Next slide, please. So now that hopefully you've all decided to submit your innovative knowledge management ideas, I'll review how the competition will work. So first and foremost, you'll need to submit an application, and all applications are due before December 10th. So mark that in your calendars. In early January, we'll then notify the semifinalists that they've been selected to move on to the next round. The semifinalists will also receive guidance on how to prepare an engaging 3-minute pitch for a panel of judges. And the panel of judges will be made up of regional and global experts, including Tara Sullivan and Emily Mangoni, which you heard from today as well. In early February, the semifinalists will pitch their ideas before the panel of judges, and the judges will have the opportunity to ask questions. The judges will then select the final KM champion innovators. The final innovators will be announced in early 2022 through YouTube premiere episodes, and they'll be awarded up to $50,000 for implementation. They'll then have 5 months to implement their KM innovations from May until September of 2022. Next slide, please. We're also excited to announce 2 themes for season 2, which Tara alluded to earlier. So this season, we'll be prioritizing knowledge management innovations for family planning and reproductive health programs that focus on youth or COVID-19. We will still be accepting KM innovations to support and improve family planning and reproductive health programs broadly, or for other specific health areas as well. However, we will be giving more weight to innovations that are related to youth and or COVID-19 during the scoring process this season. Next slide, please. So what countries are eligible for the pitch season 2? Organizations in USAID family planning priority countries in Africa and Asia are eligible to apply, as well as Ouagadougou partnership countries. You can see the list of eligible countries here on the slide, and we're requesting that you please only submit an application if your country is included in this list. If your country is not included in this list, it is not considered eligible for the pitch competition this season. So these are the eligible countries. Next slide, please. Organizations have to also meet the following criteria to qualify for the pitch. First, they need to be legally registered and be able to provide proof of registration of the entity in the area of operation. Second, they need to adhere to the family planning policies set forth by the United States government. And third, have a registered bank account through which to receive the funds. Next slide, please. In order to get started, you'll have to complete an application, and all applications should include the following information. First, we're asking that you describe the family planning and reproductive health challenge that the KM innovation will address. Then describe what the KM innovation is and how it will be implemented. Next is to describe the potential impact that the KM innovation may have on family planning and reproductive health programs, and include 2 to 3 indicators that you'll use to measure the success of your innovation. We're also asking that you describe your sustainability plan, including how the innovation will be sustained after the implementation period, and include a detailed budget and timeline for a 5-month implementation period. You can apply via the Knowledge Success website, and you can review the application form before submitting, so you can see what's required. I also highly recommend reviewing the pitch guidelines and the frequently asked questions, which are also available on the Knowledge Success website. Next slide, please. All of the submissions that we receive will be scored and selected based on the following criteria. So first, whether or not the KM innovation meets an expressed need or gap in knowledge management for family planning. Next, we'll also look at whether the idea is innovative. So for example, is it a new idea? Does it add a new component to an existing idea? Or does it reach a new audience, for example? We're also interested in the potential impact of the innovation on family planning and reproductive health programs or activities, as I mentioned. This impact could be shown at an organizational level, a country level, or a regional level, and we'd also like to see how you plan to measure the success of your innovation. We'll also be looking at whether the innovation is equitable, or the extent to which various family planning and reproductive health professionals can access and use the KM innovation, regardless of their identity. So regardless of their race, ethnicity, gender, class, age, ability, etc. Next, we'll be looking at sustainability. That'll also be an important selection criteria. For this, we'll be looking at whether the innovation can be integrated into existing systems, if there's the potential that it could be scaled up to reach a wider audience, or whether the innovation aligns with priorities set out in government strategies, for example. And we'll also take into consideration whether the innovation is feasible to implement within the 5-month time period and within the budget provided. And then finally, as I mentioned, special consideration will be given to knowledge management innovations that are focused on youth or COVID-19, but other areas are also going to be considered as well. And with that, I will hand it back over to Gayo now to introduce our question and answer session. And I look forward to hearing your questions.
All right. So thank you very much, Anne. It's now time for our Q&A portion. So please do type in the chat box any question that you might have. Remember that there are no bad questions. All questions are good questions. So just remember that this is a supportive space. So please ask any questions that you might have right now. And I'm going to give everyone a few more minutes to let the questions come in. And while you are thinking of your questions and typing it in, and again, we'll go over some of the frequently asked questions and our responses. So back to you, Anne.
Thank you, Gayo. So please do type your questions into the chat. While you're doing that, I'm going to go over some of the frequently asked questions that we receive. So if you could go on to the next slide, please. The first question that we hear is, are there any language requirements for the application process? And yes, we are accepting and encouraging submissions in either French or in English for season 2. Next slide, please. Can I submit an innovation individually? Individuals do have to apply on behalf of an organization. So individuals not representing an organization are not eligible for the pitch. However, organizations can include cross-country consortiums, country-level technical working groups, local professional associations, or other entities as eligible. And organizations can also partner together on an application. I think that we already received that question in the chat. So organizations can partner together on an application, but ultimately only one organization would receive the sub-award. So they would be granted as the secretariat of that group to receive the sub-award and coordinate on behalf of the group. Next slide, please. Next question is, my organization is not registered in one of the countries that is listed. Am I still eligible to submit an innovation? At this point, only organizations registered in USAID priority countries in sub-Saharan Africa or Asia, or located in a Ouagadougou partnership country, are eligible to apply. So if your organization is not registered in one of the eligible countries that I showed on the slide a while back, it is not eligible for the pitch. Next slide, please. What type of submissions will be given more weight in the scoring process? So given the themes for this season, innovations for family planning and reproductive health programs that are focused on youth and or COVID-19 will be given more weight during the scoring process. But if you have a great innovation that doesn't fit within the theme for this season, we definitely encourage you to please still submit it, as we will be accepting broad knowledge management innovations as well. Next slide, please. Will the pitch fund innovations that have already been created? So we get asked this question a lot, and we were asked this question a lot in season 1 as well. To us, an innovation can be something completely new that has never been done before, or it can be a new component of an existing innovation. It can also be funding and adaptation to an innovation, or expanding, excuse me, or expanding a current innovation to a new audience, for example. So this competition will not fund the continuation of an innovation that has already started and is already ongoing, but it would potentially fund an adaptation or an expansion of an innovation. Next slide, please. This question is really important. So who should be the audience for the KM innovations? The KM innovation that you propose should aim to support the work of family planning and reproductive health professionals. So this includes program managers, technical advisors, decision makers, etc., but it does not include clients seeking family planning services. most of us who work in family planning are used to thinking of our audiences for our innovations as the client or the end user who's seeking services. But we really want you, and we encourage you to take a step back. And for the pitch, we're encouraging you to think of yourself, think of your peers, think of your colleagues as the audience for your KM innovation that you're going to submit to the pitch. So what innovation would help you or your peers or your colleagues reach your ultimate program goals? And that's the audience for these innovations. That's why it should be family planning and reproductive health professionals and not clients themselves. So I hope that these answers to some of the common questions you found useful, but I definitely look forward to seeing what other questions have come into the chat. So Gayo, I'll hand it back over to you.
All right, thank you, Anne. And I hope what Anne shared with you provided clarity in some of the questions that you might be shy asking in the chat box. So, but now there are many questions also coming in. First, we have a question here for Anne. So, are innovations required always to link data and strengthening public health systems as key codes?
Thank you for the question, Andrew. No, you don't need to link your submission to data or to strengthening health systems. The only requirement is that your innovation have a clear link to knowledge management and that it supports the work of family planning and reproductive health professionals. And it could be related to data, but it does not necessarily need to be.
Okay, so thank you. So the next question is for our KM innovators, for our season 1 KM innovators. So was there any return investment from the governments where the KM innovators work? If yes, was it impactful to the various organizations? So anyone from the 4 innovators would like to share on that, to answer that question? Marine, Pretty, Margaret, or Hester?
Yeah, I can
Grace, can you
start.
please repeat the question? I had bad connection, so I lost the question.
All right. Okay, I'll repeat the question. Then Hester first. Then Marine can do the, follow up with that. So the question is, was there any return of investment from the governments where the KM innovators worked? If yes, was it impactful to the various organizations? So let's start first with Hester, then followed by Marine. Hester?
Thank you so much. So I would understand the question to look at whether government adopted the innovation and whether they found it useful. That's how I would present it in another way, unless if the one has asked want to put it differently. To us on the FP dashboard, the answer is yes, because the government owned the dashboard. Now we have phased out the project and they are proceeding with the dashboard to make sure that it's fully accessible. And they're the ones that have placed it on the Ministry of Health website, making sure that everybody, even you now, can just click and get all the information that you need on family planning. So yes, in terms of return on investment and whether government has adopted the innovation, the answer is completely yes, and they have owned it and they'll push the agenda forward. So yes, for Malawi.
Thank you, Hester. Marine, would you like to add something to that regarding any return of investment from the government where the KM innovators were?
Yeah, I think I would, to carry forward what Hester is saying, it's really important when you're talking about return of investment, you're talking about, did this innovation address a key need that the government is facing? Is this something that they're already looking to fix and you're there, you're happening to, be involved? So what that meant for me and for our innovation is ownership from them. So, the fact that they've got a lot of data and they're finally being able to understand what this means and how to use it and how to present it and how to actually use it for policy making at a country level is great. So I think looking at that leads to return on investment from an ownership perspective, from let's incorporate this into our system. So for example, one of the wins we faced is we've created indicators on PPFP which don't exist in Pakistan. And now the government is keen to incorporate those into their MIS collection, which is, I think, a huge win for us. Of course, the road to achieving that is long and incorporating those. So I think, and what is it that they're looking, how we're addressing that, and then getting their ownership is the biggest return on investment.
Thank you, Marine. I think Margaret would like to add to that. Margaret?
Yeah, so just to also say that for the Data Made Simple project, aside from working with adolescent and youth, we were also able to strengthen the capacity of the adolescent desk officers who are staff of the government, as well as monitoring and evaluation officers. And some of the initial thoughts that we had from them is this is a good way to use data. So apart from clamoring for more data, the available data needs to be simplified for decision making. And particularly in one of the states that we work, the technical working group on adolescent health and development, we're happy to incorporate it during their quarterly meeting, so that when data are presented, they only do not just look at it in that sense. Yes, data is meant for programming and decision making, but see how they can better simplify data for decision making. So this for us is a plus, but we look forward even to greater impact following. It was just a 5 months project, of course, but we also look forward to continue to count these gains as we deliberately involve the governments in all the states that we work with.
Thank you, Margaret. So I think most of the RKM innovators agree that indeed there is, gains and there are ROIs, or return of investment, for the government. Next, the question is for Anne. So it's from Mugisha. Should all innovations be connected to family planning? So what if it deals with infectious disease control and patient management? Anne?
Yes, thank you for the question. So the answer is yes. All the innovations must be connected to family planning, but that does include multi-sectoral approaches. So for example, if your innovation deals with the intersection of family planning and another health area or a non-health area, like family planning and education, for example, that would be acceptable. But family planning is a base requirement for all of the KM innovations.
All right, thank you, Anne. So next question, still for you, Anne. Lots of questions for you. Can a consortium submit an application that covers more than one country?
That is a great question, and one that we haven't received before. I would say that it depends on what the innovation is, and really it depends on whether or not it would be feasible to work across multiple countries given the time frame and the budget. So if the project does feel as though it's feasible within the budget and time constraints, then we do invite you to submit an application across countries.
Okay, so another question, this one from Davey. Is it possible to have copies of applications for Season 1 champions?
Thank you for the question, Davey. You're certainly welcome to reach out to the panelists or the Season 1 knowledge management innovators to ask them personally. However, the applications are considered confidential, but we do offer guidance on how to submit an application on the pitch webpage, which you can find on knowledgesuccess.org. So if you have any questions or concerns regarding the application process or how best to position your innovation, you can also email us at info@knowledgesuccess.org.
Right, so thank you. This will be, I know there are still lots of questions, but due to limited time, this will be our last question, still for Anne. So one of the speakers said that they will focus on innovations on COVID-19 and youth. So would this also require a family planning connection?
Yes, great question. Thank you for asking. To clarify, yes, if you do choose to work on an innovation that focuses on youth, it also needs to focus on family planning and reproductive health. And if you choose to focus on a knowledge management innovation related to COVID-19, it also needs to focus on family planning and reproductive health. So to confirm, the themes for Season 2 are youth and family planning reproductive health, and COVID and family planning reproductive health.
Okay, thank you very much, Anne, and thank you to everyone for your questions. As unfortunately, we cannot answer all due to limited time. So thank you everyone for that very insightful and engaged chat discussion. So now we are looking forward to receiving your application by December 10th. Again, that's December 10th. And also, you can also email us at info@knowledgesuccess.org with any questions. Again, that's info@knowledgesuccess.org. I'd like to thank our speakers, Tara Sullivan, Emily Mangoni, Hester Nyasulu, Margaret Balaji, Marine Shahid, Priti Chaudhry, and Ballard Sarah, and of course, our Zoom administrator, Emily Haynes. We will be sending you a recording of today's webinar. So many people are asking about that. Yes, we will be sending that. And if you are subscribed to our email, you can sign up on our homepage at knowledgesuccess.org. You will receive a notification when we post our next webinar. So please do subscribe to our email. So thank you once again and see you next time.